Doctor, thank you so much for giving your time today for a talk show.
Welcome. Thank you. Thank you.
We are from Navya. We are a health tech company. We help doctors to use multiple smart products and make their practice and clinic technologically smart.
Yes,
And
yes.
we help doctors and patients to connect with our multiple suites of Navya smart product. And we would like to also tell you that right now we have over 8,200 doctors who are using our product across 400 plus cities, and we have
Okay,
been
very
able
good.
to and we have been able to drive over 5 million plus consultations through our platform.
Okay. Okay,
So
yeah.
that's who we are. And we bring to our viewers, we bring one more episode of healthcare in the new normal. And this time we have Dr. Priyajit Panigrahi, and he is one of the most experienced doctors and ENT specialists we have with us. I will just go with his experience. I'll just tell a couple of words about him. He has done his MBBS and DNB in ENT, MBBS from MKCG Medical College, DNB from Lourdes Hospital, and SRship from SKN Medical College, Pune. He has been associated with KKR ENT Research Center, Chennai, and he is the chief ENT and head and neck surgeon with Tata Steel Medical Hospital, Odisha. So, doctor, I hope I got all those names correctly. If I have made
Yeah,
any
yeah.
mistake, please do come in.
Yeah. No, everything is all right.
Wow. Thank you so much, doctor, for giving time. Today's topic, as all of you know, that we're going to talk about COVID-19 associated mucormycosis. That is a new term which we are seeing, new disease which we are seeing here. So, doctor, to start with the first and very obvious question, and we would like to keep it very simple for the viewers. It is becoming a lot of confusion around it.
Yeah,
What
yeah.
exactly is black fungus infection or mucormycosis? What you call this?
Okay. Black fungus, mucormycosis. Actually, both are same. The name black fungus, I will tell you why it is called black fungus. Mucormycosis, actually, it is not a new fungus. It is a very common fungus. It is associated everywhere, like in over soil, inside soil, in fruits, in vegetables, everywhere. That's why we often tell to wash fruits and vegetables before consume. It is a good
Wonderful.
habit because of that only. And the black fungus, the name is because when it attacks, usually the spores are everywhere in the air. So
Okay.
usually it enter into the body through inhalation, through our nose and mouth. So once it comes to the nose, then it stagnant in the nose and our sinuses. Once it's sinuses, it started growing and it attacks the worst thing is it attacks the blood vessels. Once it attacks blood vessels, it will block the blood vessel by making thrombosis, clotting, clots,
Understood.
making clots.
Got it.
Once it blocks the blood vessel, then the blood supply to the particular organ or tissue inside the nose or ear, eye or
I
jawbone, the all localized surrounding tissue will deprive of oxygen. So ultimately it will die. The tissue will die
the
out
tissue.
of oxygen. Yeah. So once it will die, there is a term called necrosis. Ischemic necrosis means out of it is not getting the blood supply, not getting the oxygen. So the color of the tissue turns black. That's why it is known as black fungus.
So it is
Yes.
not an old virus. It is something which was always there. And
It is a
however,
fungus. It
it
is
is
a
a fungus.
fungus
Okay. It is not a
associated
virus,
with
it
this
is a
virus.
fungus.
Yeah,
Okay.
yeah.
And it was
It
always
is.
present. It was always
Yeah, it is
present in
always
the
present. Even normal people, we are always inhaling. That is going inside, but we never suffering
face
because of
the
our
difficulties of
immunity.
this.
Yeah, our
Understood.
immunity is fighting with that. So that is a common
Oh,
thing.
wonderful.
But in
So,
COVID, yeah, for the COVID patient, the problem is immunocompromised. They are
ah,
immunocompromised ones. That's why it attack.
so to our viewers, to make it very simple, black fungus or the disease is something which was always there. It was always present. That is why we were supposed to wash fruits and vegetables and have it. However, people who are recovering or who are going through COVID, because of
Yeah,
they are becoming immunocompromised in nature. Their
yeah,
immunity is going down. So this
yeah,
fungus is starting to hit the body again.
exactly. That's why the
Understood.
fungus is actually an opportunistic fungus. It
It's an
attacks the
opportunity.
weak one. Yeah,
Very correctly put. Wonderful. To the next question, doctor. Now, there is one more disease very recently. I'm not sure whether it is a news, fake news, or myth. We are talking about white fungus as well. Is that something which is very new again?
I also heard from yesterday only. There is in our textbooks, there is nothing called white fungus. But I don't know, the color may be white, maybe some other species or maybe some other variety of mucorfungus, mucormycosis. So it
Okay,
is yet to study. The study is not done yet. Some few, only 4 cases has been found in Bihar. So we need to wait for that.
understood, understood. So then, to our viewers, this is pretty new when we hear about white fungus. Still, there are doubts about it, and we will
Yeah,
try to
yeah.
see how to take that forward. To the next question again, doctor, we would like to understand, as you pointed out in your last discussion, that it is very privy that this virus, this fungus, is affecting COVID-19 patients. So, how exactly is this related to COVID-19 patients, and at what point of time does this hit the body of a patient?
Exactly, exactly. Actually, COVID-19 patients, either during the treatment or after recovering or during the discharge, any point of time, if the patient already lost his or her immunity, or the patient is consuming steroid during the treatment, because steroid, we know it is a life-saving drug. So we have to give steroid to make the patient to keep the patient alive. So we can't compromise with steroid. But something like if we need to use the steroid judiciously, not high dose, not for prolonged period. The problem because of steroid, because steroid has a property, it will increase the sugar level. So if the patient is a COVID-19 patient, if the patient consuming steroid, and again, if the patient is a diabetic, uncontrolled diabetic patient, then 3 factors makes the patient totally immunocompromised.
Understood.
Then this, yeah. So once immunocompromised means that tissue body is vulnerable for infection, any infection. And this fungus is a property, it attacks only the weaker ones. So it takes a chance. He's thinking that he's the weakest one, I will attack him.
Weakest one is
So it
taking.
comes to, yeah.
So again, to simplify this a bit, so this is specifically for diabetic people, people who are taking steroids. Those are the
Yeah.
patients who have to be very careful and keep a watch.
In simple, it is not only steroid will make immunocompromised. There are other drugs also there. Like
Okay.
if the patient is a cancer patient, if the patient is a post-transplant patient, because if he is a patient, a recently donor patient, means a recipient patient, he has done a kidney transplant surgery, then for that he needs to take immunosuppressant drugs. So again, these drugs will make him more immunocompromised. So if a malignancy patient, the malignant cancer patients are already immunocompromised. And most common is diabetes, because diabetes is most common disease.
Understood. So to the viewers, it is very clear. If you are diabetic, if you're taking steroids, if you are taking immunosuppressant drugs during your
Exactly.
treatment, you will have to be very careful for this
Exactly. Yeah.
specific and keep a note of specific symptoms of this disease. And then only you will be able to treat it properly. So this, doctor, then after this, it brings us to the next question, and very common question, that what are the common symptoms?
Yeah, it is an important question because there are warning signs and symptoms for which the patient need to be alert all the time. If he is a COVID patient or discharging or recently discharging recovering patient. So actually this fungus once attacks, it has 3 stages. One is the early stage, which is known as the sinusitis stage. It remains in the nose and sinus. Then it spread to the eye, that is known as orbital stage. Then it is goes to the brain, that is known as intracranial stage. So
Okay.
individual stages, different symptoms and signs. So we have to be careful about the earliest sign, because earliest treatment only save the life of the patient. So at least once since develop, grow inside the nose and signs, there will be redness and pain around the eye. Then there will be paresthesia over the cheek and the facial face. Then sometimes there will be paresthesia of the facial muscles, means there will be facial paresis. Also, there will be pain over jawbone. There will be loosening of tooth. Sometimes tooth get broken. Then sometimes there will be nasal discharge. Sometimes there is a bleeding from nodes. Sometimes nasal blockage and stuffiness of nodes. Sometimes there will be vision, blurred vision. The patient not able to view properly, and also the movement of eye also there will be difficulty. So these are all warning signs and symptoms. One should be very careful about those things.
So if we want to simplify this further, Dr. Panigrahi, for our viewers,
Yes,
what would be the top 5 symptoms which people should be really watchful about?
exactly. The top 5 I would like to say: redness around eye, numbness
Okay,
over cheek, pain over jawbone, loosening of tooth, or any discharge or bleeding from nose.
understood, understood. We have
Yeah.
noted those down. And is there any specific time during the COVID period a patient is dealing with that they should be aware of this 5 or 6 symptoms?
There is no specific time, but what we are seeing, and lots of cases are seen, those are happening around 2 weeks post-COVID. Once you discharge today, then within 2 weeks, the symptoms comes. Okay. So I think we can take it as a first month is a very critical period.
First month. That is
because
post-COVID.
because already the medicines they have started. Once they will discharge from hospital, that does not mean they will stop the medicines. They have to continue for a few more days. So once if we will talk about steroid, the steroid dose duration is around 15 days. So around 2 weeks we have to be careful.
That is also post-COVID.
Post-COVID, yeah.
Post-COVID. Wonderful. Wonderful to know the symptoms and the timing.
But
Also,
there is no
doctor,
particular time. It can develop anytime. We can't
can
say
it
in
develop?
particular.
Can it develop also during the process is on, during the steroids and the other high
Yes,
drugs are given?
yes, yes. Especially if the patient is uncontrolled diabetic patient, it can come during the treatment also.
Understood. Very good points over here for our viewers to understand. Doctor, coming back to this as well, when we spoke about the symptoms of black fungus, is there
Yeah,
any main organs which this fungus affects? In the, as you said, obviously the eye and the nose and blurred vision. But apart
yeah,
from
exactly.
facial, is there any organ inside the body which
Yes, yes,
the
yes,
fungus is affecting?
yes. Yes, the mucormycosis actually affects lots of organs. There are types of mucormycosis according to organ involved. Like what we are more concerned now because of COVID is the rhino-orbitocerebral mucormycosis. Rhino means nose, orbito means eye, and cerebral means brain. So this classification is according to mucormycosis. This type of mucormycosis, it involves the nose, sinus, eye, jaw, and brain. So it is known
Brain.
as rhino-orbitocerebral mucormycosis. There
Okay.
are other mucormycosis. One is pulmonary mucormycosis. It is also can be happen in COVID patient because ultimately it involves the lungs. Okay, so the force will come to the lungs and it will affect the pulmonary mucormycosis. Also a possibility in case of COVID. Others which are not possible in means not seen in this pandemic. There are cutaneous mucormycosis, means the skin
Okay.
is also involved.
Skin.
Then there is GI mucormycosis. What I have told earlier, why we wash the fruits and vegetables before consume.
Yes.
Because if we'll eat mucormycosis spores, it will stay in the stomach and it will the GI tract, it will grow there. So there will be GI gastrointestinal mucormycosis also there. And there is one
Understood.
more is the disseminated mucormycosis, means that spread through the blood vessel to every organ. It can involve any organ. Okay.
Understood. So
So
it can
main,
affect across the body, multiple organs
yes,
can
yes, yes,
become a victim of
yes,
this fungus.
yeah, exactly.
Understood. And when you say that the first symptoms are very important to note and helps us treating the disease early. So a basic question among everybody of us and the patients is that how dangerous is this? How dangerous is this? Something that even more dangerous than COVID, or probably will make you go into a hospital setup again? So they want to know that if this disease come, how dangerous is it? Kya mera health pe, like, is it that difficult that you will end up in a hospital? You may even die from it. How serious is this?
Yeah. Actually, frankly speaking, it is a very serious disease, very dangerous disease because first of all, the initial stage and the final stage, the duration is very fast.
Acha.
And there is chance that we can miss the diagnosis in the initial stage. And once we miss the diagnosis, in the next week, the patient will be in the late stage. That is why this is dangerous. And for example, if the patient, means today the patient is in a sinusitis phase, means the fungus developed in the nose and sinus, then in within 3 to 4 days, it can involve the jawbone and eye. Within 5 to 7 days, it can go to the brain. So it is
So the
very fast.
time
If
is
today,
very fast
yeah,
when it is detected.
exactly. So the treatment is we have to do according to that. If today
So,
diagnosis some, yes,
so very clearly to our viewers is that treat this disease and symptoms on in top priority. You do
as
consult
fast as possible.
immediately,
Yeah,
as
as fast
fast
as
as
possible.
possible, because we don't have time over here, because the
Exactly.
fungus acts very fast.
Yeah.
Understood. Understood. Also, then it comes one more question which the viewers wanted to understand is that uh, what are the type of medicines or which can be administered, or is there any set guidelines given, and is the disease
Yeah.
curable?
Yeah, this is curable, no doubt. As I said, we have discussed before, the earliest diagnosis is the only option available. If the patient is getting, if the diagnosis is getting delay, means it is difficult to survive the, for the survival. Okay. Because we know this is the first, it grows very fast. Then about the options, what to do is first is the surgery. The surgery is an important role
Oh,
because
okay.
we have, first we have to remove the tissue as much as possible.
Even
For
doctor,
example,
even in the first interaction itself, that is the first step in the
yeah,
treatment, or it can be
yes,
medication can be
no,
used.
no, 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 no. Once, if today I am diagnosing a patient suspected mucormycosis, because mucormycosis diagnosis will come from biopsy, and biopsy will take 3 4 days. But that time the disease get progress.
Oh,
So we no need to wait for the biopsy. Yes, some first we can suspect and we can send for a KOH mount. Means the whatever distance from nose, we can send the KOH mount. Okay, so that we can diagnose the thing as mucormycosis. Then we'll immediately post for surgery.
but
Surgery,
this is
what we
very
are doing?
interesting point which you are mentioning, doctor, here, that suppose today I happen to consult you and I have this disease, then the first option which I have immediately, if I am diagnosed, which will can be done, is surgery.
Yeah, exactly. I am telling you, if you came to my consultation and you are suspected of this, you have symptoms, then first thing I am going to do is a nasal endoscopy. Okay, I will see your inside nose, and if there will be signs like some crusting will be there, some black color crust or your turbinate turning black, then my first job is I will send for take a biopsy, but the result will come later. That is a different thing. And I will send the discharge for a KOH mount, potassium hydroxide mount. That is the diagnostic here. So if the result comes as mucormycosis, then I immediately tell the patient do all the test, means required test for the surgery thing, and I will post for surgery.
Wow, this is very alarming. That is one of the
Yeah,
information which should be available with our viewers. That the type of treatment which is available is surgery is the topmost first priority which has to be given.
yeah,
Is
but
there any
that is not the standalone option. Means
understood?
surgery is not the standalone option. We have to do surgery, and along with we have to start antifungal drugs.
Understood. Understood. Just a second, Priyanka, is the video of doctor stuck, or are you able to see it?
Yes, I'm able to see.
Okay, fine. So it was stuck on my screen. Fine. We get back to our discussion again, Dr. Paniguri, and thank you
Yeah,
so much again for giving us a bit of time. So, as you were
yeah, yeah,
mentioning, surgery and the medications which will be there. One very important question which the viewers wanted to understand here is, see, current situation, every doctor is trained. I am very sure you are also trained and you have taken out some time for us. So, getting to a doctor is a big challenge right now because of
yeah,
the sheer amount of load which a doctor is handling.
yeah.
Can virtual consultation a VC with a doctor on screen be the first level of diagnosis of this disease?
For first level of diagnosis, I will definitely tell yes. Yes, it will definitely help. Yeah,
Understood. So
because
this
for
is a
mild
very,
things we can, yeah, for
yes,
mild things, not severity things, we can put with the virtual thing will solve the problem.
this
If
is
we have
this is a
suspect
very,
anything, yeah, yeah.
yes.
If we are suspect anything, then we will a physical met is important.
So this is a very interesting point, and to the viewers, I would like to mention here that video consultation, which is the boon nowadays in COVID times, the teleconsultation, can be one of your first go-to option if you feel anything which is happening to you when it comes to black fungus. Obviously, the next step is what Dr. Panigrahi mentioned, to go to a doctor physically. But the early detection can be done on a video consultation. And
Yeah,
people should take a note of it. We should explain this to our friends, family, doctors, and other friends that please take this up as soon as possible so that your lead time to reach a doctor can be reduced. This is a very important point, doctor, which you are making.
yes, yes.
Apart from this, also, one more question which we would like to understand, that how this disease can be prevented during the course of COVID. Certain diet, certain medication,
Yeah,
or
yeah,
certain
yeah, yeah,
can
yeah,
this can
yeah.
this be prevented?
Yeah, this is preventive. Only as we know, since till now we are discussing about one thing, that is the steroid. So if we'll use the steroid judiciously, means the timing, the duration, the dosage, when to start, for how long to start, for how much to start. If these three things will be cautious, then there is chance we can prevent.
Understood.
For
Understood. So very
example,
important note to the
yeah,
to our viewers. What Dr. Panigrahi here is mentioning is that it is very important to time the steroids, and do not take steroids at your own wish and whims and fancy. Do consult a doctor and only take it when doctor is suggesting it.
for example, if a patient diagnosed today, or if you have got symptom today, high fever or something, then if you are starting steroid, that is a wrong decision. You should not start steroid. So during the COVID, because the initial stage, the virus is replicating. If you give steroid, then the replication phase of virus will prolong. It will make more dangerous. That's why we should not give steroid. We should give steroid in the 5th or 6th day of the COVID treatment period.
Very important point, and Dr. Panigrahi, I would like to just thank you so much for giving us time, because I'll tell you something. We have our friends, my family have been going through the disease, and we are seeing that at the grassroots level, the knowledge is missing. People are
Yeah,
administering by themselves steroids on the first day, which is leading to the problems which you are mentioning. So very important, viewers, when you are seeing this, only go for steroids after consultation to a doctor. Do not
exactly.
administer by yourself. That
Yeah,
steroids are life saving, but it can also bring back a very dangerous disease like a black fungus.
yeah, yeah.
So
Second
this
thing is glycemic
yes,
control. If a
okay,
patient is a diabetic, then glucose control is important.
okay,
That is
okay.
also important thing. Yeah.
So managing blood glucose level with
Yes.
medicine, with insulin, with other
Mm,
medication is
mm,
very
mm,
important for this
mm.
disease
For the
to
prevent. Yeah.
not go ahead
For
and
the
prevent.
prevention. Yeah.
So, doctor, this brings me to one more question. Uh, so, we would like to know, the viewers would like to also know, after COVID, post COVID, when people have been administered steroid, we see there is a spike and irregularity in diabetic patients. The sugar level goes up, goes down. So, most of the medications which are being prescribed post COVID they are prescribing uh, diabetic medication to control the sugar. How long after you have recovered from COVID and you have come home or you have got a negative certificate, does this
Yeah.
fluctuation last? And is the prolonged fluctuation a result, a reason for black fungus as well?
No, no. Actually, it depends on body to body. Because if we or the patient is already a diabetic patient, because the diabetes is there since long, or the patient is on insulin since long, then it is things are difficult that way, because steroid we are giving to save the life only. And again, the alternative ways, the steroid is increasing the sugar
Blood
level
sugar.
also, blood sugar also. So the control thing is very much important in that level. For patients who are not known diabetic, because of COVID and steroid, they got diabetes. So those are in a control level. We can control those patients. So that is
Understood.
important actually.
Very one more question, which even I want to know, and I was also helping my parents to recover from COVID. Post COVID, what are the diabetic ranges which a person should be able to maintain? Any idea, any light on that, doctor?
That is nothing post COVID any particular guideline for that. For any patients, there are limitations like the fasting should be within 100 or port frontal should be within 120, like that. That is there before
Oh,
also. The guideline is same also. Yeah.
so that has to be controlled
Yeah,
and
exactly.
maintained. Those were the major questions, doctor, to understand the disease. I will say, uh, would also before we end this conversation, we would also like to understand from Dr. Panigrahi that what is your message to the people and our viewers here.
Yeah, my message for, as we know, we are dealing with the COVID second wave right now, and we don't know whether a third wave will come or not. And there is chance everybody is expecting a third wave will come because of the situations. So
Yes.
the reason why the first wave after second wave and third wave is coming, because of our own negligence only. Because once the lockdown will over, then we are thinking COVID over, but actually COVID not over. Once the daily cases of COVID comes to zero, then only we'll think COVID over. And it was never reached zero till now, since the last year also. So once the lockdown over, we are again not wearing mask, we are not washing hands, we are not maintaining distance, we are going here and there. So that will cause the second wave. And if this happens again, then third
For
wave
the
will
third.
come. No, nobody can stop that. So my request to everybody, just wear mask, maintain distance and hand wash, and keep these guidelines for at least 6 months to 1 year, irrespective of government orders about lockdown or something. It is nothing to do with that. You just keep these three things: washing hand, keep mask, and maintain distance. That you continue for at least 6 months. Then only we can defeat COVID. Otherwise, it is impossible.
Understood, doctor. And very important point for our viewers, that please keep to your COVID behavior and follow them strictly, even if you think that the cases have reduced. Because as doctor mentioned,
Exactly.
until and unless it
Exactly.
is zero for a prolonged time, it can anyway come back and hit you again. Thank you so
Exactly.
much, doctor. Also, one very important point I would like to reiterate again for my viewers here, that early detection is very important for black fungus.
Yeah.
Virtual consultation can help you do a early detection. So
Sure.
even if
Yeah.
you are not able to get an appointment and get into line, look for a virtual consultation and consult the doctor. One more very important point is, do not take steroids at your own whims and fancies. Consult a doctor
Exactly.
and only then take steroids. To the viewers, thank you so much for your time as well for listening to this. Dr. Panigrahi, we would like to also listen to your last uh, message to the patient during these times.
Yeah. One more important thing I would like to share with my all citizens, that whoever either suffering from or not yet attacked by COVID or already recovered from COVID, for everybody, we know the virus is coming to our body through nose and mouth, and it resides in our nasopharynx and oropharynx. The places behind the nose is nasopharynx and behind the mouth is oropharynx. There the virus resides for few days. And before it jumps to the lungs where the severity starts. So before that, if we use something that will, if that will kill the virus, then we can save ourselves to going towards the severity. So what to be done is, there is a betadine gargle, and betadine not povidone iodine. Okay, povidone iodine molecule chemical is not a new, it is there since long. and we are usually using for gargling purpose. And the nowadays companies are making spray form. So if we will use that in mouth every day, 3, 4, 5 times, then we can inhibit the virus and even kill the virus, and we can stop the virus to reach lungs. That is an
And
important.
becoming more severe.
Yeah, exactly.
This
And
is a
myself is
great.
doing.
This is a great point,
Myself is
doctor.
doing that regularly. Yeah.
Wow, wow. This is a wonderful point. And we would also request our viewers to listen to this very carefully and follow these guidelines because it can help you to not get the COVID and become serious and go to a hospital. Thank you so much again, doctor.